Welcome back to JC Nursing. I'm Shoba Jayakumar, one of the nursing job exam education specialist, JC Nursing. In this video, we are going to see some of the questions and answers, rational, concept, disease conditions from emergency nursing. That is the continuation of the last video. Question number 20 up to 20 we have seen. In this video, we will see about question number 21 to 40. Alright, let us start the questions. Question number 21. The physician's prescription rates as follows. Piperacillin sodium 650 mg intravenously every 6 hours. The medication labels rates as follows. Reconstitute with the 4.8 ml of bacteriostatic water to yield piperacillin sodium 2 grams in 5 ml. How much piperacillin sodium should the nurse withdraw from the vial for 1 dose? What's the answer? What's the formula we have to use here? The formula is always doctor's order into amount divided by doctor's available dose. So, doctor's order. Here the doctor's order is 650 mg. And available dose amount is into ml. That means 5 ml. And available dose is 2000, 2 gram. 2 gram is equal to 2000 mg. So answer is, when you put it into the calculation, answer will be, you will get the answer as 1.625 ml. Okay, let's move on to the next question. Question number 22. The provider's prescription rates tobramycin sulfate 7.5 mg intravenously twice daily. The medication labels rates 10 mg per ml. How much tobramycin sulfate should the nurse administer for 1 dose? So always you remember the question medication calculation comes itself, the formula is same formula. So formula always it remains same, doctor's order into amount divided by doctor available dose. This is the formula. So in this question, the tobramycin sulfate 7.5 mg is the order and available dose is 10 mg per ml. Per ml means 1 ml. So amount is 1 ml, 10 mg is available dose. So we'll put it into the formula 7.5 into 1 divided by 10. The answer. So same formula, desired amount, ordered dose into amount divided by available dose. So 7.5 mg into 1 ml divided by 10 mg equal to 0.75 ml. So same formula you need to apply all kind of questions. So you will get correct answer. Next question, question number 23. The mother of a child calls to the emergency department and informs that her child is having bleeding from the nose. The nurse instructs the mother to do which of the following? Pinch the nostrils for 5 minutes and then recheck for bleeding. Have the child will sit with the head tilted forward and hold pressure on the soft part of the nose for a period of 10 minutes. Which will be the answer? Answer is D. Always you remember the child should be positions erect, sitting with the head tilted forward to avoid blood dripping posteriorly to the pharynx. So this will help to aspiration against the respiratory system. This is why advising them to sit in the erect position to prevent aspiration. Question number 24. The nurse evaluate the ABG results of a client who is receiving supplemental oxygen. Which findings would indicate that the oxygen level of arterial blood gas is adequate? So here there are 4 answers given. Always you will know what is the partial oxygen level, what is a normal oxygen, partial oxygen value from the ABG, arterial blood gas analysis. You should know the normal value of ABG. So pH, normal ABG pH, arterial blood gas analysis, normal value is pH 7.35 to 7.45. Partial pressure of oxygen, PaO2, is 75 to 100 mg. Partial pressure of carbon dioxide, PaCO2, is 35 to 45. Bicarbonate value 22 to 26 m equivalent per liter. Oxygen saturation is SpO2 is 94 to 100 percentage. So in this question, the answer is the 80. Oxygen value is 80 mg is the correct one. From these values, we can identify blood gases can also measure the hemoglobin and hematocrit level, and electrolyte values also, potassium, calcium and sodium also we can find out from this ABG values. So bicarbonate levels, based on the bicarbonate values, you will get all the electrolyte values. Imbalances you can identify. Even hematocrit value you can identify based on the oxygen percentage of oxygen in the blood. You can diagnose the conditions. Next question, question number 25. A nurse assesses a client in a motor vehicle accident and suspects that the client's arm may be broken. The nurse takes which immediate action? So, initial action. Always you have to remember the keywords. Immediate action. So, always immediate action comes immobilize the arm. That's the answer. So, when a fracture is suspected, it is imperative that the area be splinted before the client is moved. Emergency help should be called for it if the client is external to the hospital, and the physician is called if the client is hospitalized. Next question. A client who is experiencing seizure activity was sent to the emergency department. The nurse would implement which action to prevent aspiration? The answer is D. Position the client on the side if possible with the head flexed forward. Why this action is needed? Position the client on one side with the head flexed forward allows the tongue to fall forward, and it will facilitate the drainage of secretions, which could help prevent aspiration. All right. Next question, question number 27. The nurse is planning to assist with obtaining a set of ABG measurements for a client. The nurse plans to provide which of the following items to optimally maintain the integrity of the specimen? Answer is B. ABG sample is obtained using a heparinized syringe. Always we need to use heparinized syringe, and the sample should be sent to the laboratory immediately. The preservatives cannot be used. So immediately before clotting, we need to send the patient blood sample to the laboratory. So answer is B. Then question number 28. After receiving a client's serum electrolyte levels, the provider prescribes an isotonic intravenous infusion. Which IV solution should the nurse plan to administer? This is something important question. You should know, you should identify the concept of this. IV fluids, what's the action of IV fluids? You should know. What are the types of IV fluids? Here the answer is 5% of dextrose in water. What is the reason to have this? This is the answer, 5% dextrose. What kind of solution is this? 5% dextrose. Everyone should know. Okay, so let us see what are the types of intravenous solutions we are using when we are working in the hospital. We are using three types of intravenous solutions. One is isotonic type of solutions, one is hypertonic type of solutions, and hypotonic type of solutions. Isotonic solutions means same osmolarity of our body fluid. Hypertonic solution means high concentrated solution. Hypotonic means it's low concentrated solutions. So certain conditions doctors will prescribe hypotonic solutions. Certain conditions doctors will prescribe hypertonic solutions. Certain conditions isotonic solutions. Now, same osmolarity of normal body fluid solutions will be prescribed. Let us see why this kind of solution, what is the action of these solutions. Isotonic solutions have same osmolarity of serum and other body fluids. It's a function of this isotonic solution. If you see, it maintains the body fluid status by staying in the intravascular space. It helps to expand the intravascular compartment without pulling the fluid from other compartment. It will not move, pull the fluid from intravascular to extravascular or extravascular to intravascular compartment. It will not pull. So, we use this kind of solutions. It is indicated for hypovolemia. Hypovolemic conditions, we use this kind of medications. Isotonic solutions examples are 5% albumin, 5% dextrose, oral, normal saline 0.9%. These are example of isotonic solutions. Then second type is hypertonic solution. Here, this kind of solutions have higher osmolarity than serum and cause fluid to be pulled from the interstitial and intracellular compartment into the blood vessels. It changes the body fluid status by drawing fluid into the intravenous compartment from the cells and the interstitial compartments. So, this is used to reduce the risk of edema and to stabilize the blood pressure and regulate the urine output. So, in these kind of conditions, hypertonic solutions will be used. Example of hypertonic solutions: 25% of albumin, dextrose 5% in half normal saline, dextrose 5% in ringer lactate, dextrose 5% in normal saline, 3% sodium chloride, 7.5% sodium chloride. Then third type is hypotonic solutions. Here, the lower serum osmolarity can be seen for this kind of solutions. It will cause fluid to shift out of the blood vessels into the cells and interstitial spaces. It changes the body fluid status by shifting the fluid out of the intravascular compartment, hydrating the cells and the interstitial compartments. It is used when diuretic therapies and cells are dehydration for hyperglycemic conditions. So, this kind of solutions will be used. Example of this kind of solutions, hypotonic solutions, are dextrose 2.55% in water, half normal saline, 0.33% of sodium chloride. So, in this question, answer is 5% dextrose in water is an isotonic solution, which means that the osmolarity of the solution matches the normal body fluid. Alright. Next, move on to the next question. Question number 29. A child with a hemophilia is brought into the emergency department after being hit the neck with a baseball. The nurse immediately assesses the child for factor 8 deficiency is the answer, because hemophilia. So, patient is having the history of hemophilia. Immediately, we should remember the hemophilia is a bleeding disorder. It is factor 8 deficiency disorder. So, once the person is having any kind of bleeding disorders, there is a risk for bleeding. So, always we have to check any kind of bleeding deficiency disorders are there. So, we need to check the factor 8 deficiency. So, answer sorry. Question number 29. A child with hemophilia is brought into the emergency department after being hit on the neck with a baseball. The nurse immediately assesses the child for airway obstruction, factor 8 deficiency, spontaneous hematuria, headache and slurred speech. Here what is the answer? It's something confusion question. Hemophilia. We all know hemophilia is factor 8 deficiency disease. Immediately we will select factor 8 deficiency, but this is wrong answer. Always we remember the question is immediately assess. So, the highest priority, ABC is the priority. So we need to check the airway obstruction. Because the emergency after being hit on the neck with a baseball, so small hit also the patient is risk for bleeding. Once the bleeding comes in the around the neck, it may press the airway and it will cause airway obstruction. So ABC is the priority. Answer is airway obstruction. Trauma to the neck may cause bleeding into the tissues of the neck, which may compromise the airway. Although hematuria is the symptom of hemophilia, it is not associated with the neck. Headache and slurred speech are associated with the head trauma, but factor VIII deficiency here, it is not a symptom of hemophilia, but it's rather a common form of the disease. All right. Next question number 30. A client is dead on arrival to the emergency department and the family of the client states that they do not want to autopsy. Which statement should the nurse use in response to the family? The answer is A. I will notify the medical examiner of your request. This is the correct answer. Why this is the answer? Nurse should notify the medical examiner or the coroner when a family wishes to avoid having an autopsy on a deceased family member. Always we need to inform to the authority people. Many circumstances require an autopsy in specific circumstances, including sudden death and a suspicious death and death within 24 hours of admission to the hospital. Autopsy is not a requirement under federal law. Depending on the state, it is not mandatory for every client who is dead on arrival to have an autopsy. Let's move on to the next question. Question number 31. A woman comes to the emergency department in a severe state of anxiety after a car accident. The priority nursing intervention at this time would be 2. So always we have to say the keyword. Here the question is priority nursing intervention. So all the answers will be correct. We need to select the priority answer. Remain with the client. Put the client in a quiet room, teach the client deep breathing exercise, encouraging the client to talk about her feelings and concerns, which will be the incident, which will be the correct answer. So, anxiety patients, severe state of anxiety, a car accident. What will be the initial answer? The correct answer is A. Remain with the patient, remain with the client is the answer. Why this is the answer? If the client is left alone with severe anxiety, she may feel abandoned and become overwhelmed. So placing the client in a quiet room is also indicated, but nurse must stay with the client. Let's move on to the next question. An emergency department nurse is caring for a female client who is in the acute phase of rape trauma syndrome. The following are nursing interventions apply to the care of the client except. Here the keyword is except. So only one wrong answer. Only one wrong answer. Other answers are correct. We need to find out the wrong answer. Which will be the answer? B. Encourage the client to talk about what she did to cause the rape. That's the wrong answer. We should not ask them to explain their cause. It will lead to more difference. Wrong. So other answers are correct. Assess the degree of injury to the sustained during the rape. That is the correct answer. Then obtain the client's return permission for examination and treatment. That is important. Explain to the client and her reasons are normal, and then they may continue for weeks after the rape. All the informations we could give. So the wrong answer is B. Answer B. Rape trauma syndrome is the acute or immediate phase of psychological disorganization and the long-term process of reorganization that occurs as a result of attempt or actual assault. During the acute phase, which occurs immediately after the assault, emergency assessment and treatment are provided and forensic evidence is collected. This is the action we are supposed to do during the acute phase. The nurse would always assess the degree of injury, sustained during the rape and immediately treat any life-threatening injuries. That's the initial intervention they're supposed to do it. The client should never left alone at this time and should be provided with calm and supportive interventions. Next, we move on to the next questions. Question number 33. A client is experiencing acute alcohol withdrawal and 7.5 mg of diazepam Valium intravenously has been prescribed. The medication bottle indicates that there are 5 mg per milliliter. The nurse draws how many milliliter into the syringe to administer the correct dose. Always we need to follow the same formula. The formula is doctor's orders into amount divided by available dose. So same formula also we need to apply here. Doctor's order 7.5 mg, available dose is 5 mg per milliliter. So same we need to put it into the formula. 7.5 mg into 1 ml divided by 5 mg equal to 1.5 ml. Next question number 34. A nurse in the emergency department is admitting a client with carbon monoxide poisoning as a result of a suicide attempt. Which of the following services should be initiated first? Here the keyword is initiated first, which will be the answer. Whether the patient is go for the psychiatric consult, neurological consult, or occupational therapy or psychological rehabilitation, we need to see. So the initial concern is patient is going for suicidal attempt. So patient is depressive patient. So in initial concern, we need to focus on this psychological aspect. So answer is A. The client with carbon monoxide poisoning as a result of a suicide attempt should have the psychiatric consult. Other necessary of the neurological consent would depend on the nervous system and poisoning, how much aspect they have affected. Based on that we need to focus. It's later. Next question number 35. In emergency department, a client with chronic respiratory failure is dyspneic. The client becomes anxious, which worsens the feeling of dyspnea. The nurse teaches the client which of the following methods should the best interrupt the dyspnea, anxiety, dyspnea cycle. The keyword here, best interrupt. So, which will be the answer? Answer is B. The anxious client with dyspnea always taught the interventions to decrease the anxiety, which include relaxation, biofeedback, guided imaginary, and distraction. So these are the interventions always we have to focus on that. This will stop the escalation of feeling of anxiety and dyspnea. So the dyspnea can be further controlled by teaching the client breathing technique. How the patient has to go for this breathing technique, which include pursed lip and diaphragmatic breathing. This will be helpful. Coughing technique are useful, but breathing techniques are more useful because it will reduce the pain, anxiety. It will decrease the anxiety. Because the client is anxious client. Always we need to focus on that. What is the priority action? If there are many actions are also there, anxious patients, when they are going for the deep breathing exercise, it will reduce the pain, and it will help to improve the oxygenation with the tissues. Question number 36. A nurse is assessing a 45 years old client in the emergency department for the urinary calculi. The client received 4 mg of morphine sulfate and the pain was relieved. The client states to the nurse, "I am scared to death that I will come back. That was the worst pain I ever had. Like a knife going from my right side to my groin." Which nursing diagnosis would be appropriate for the nurse to make regarding this statement? So this statement is express their feelings. So in this kind of situations, what we need to do? We are allowing them to talk. That's the key. So question is, They are expressing anxiety. So what is their the state of mind? We have to read it. The answer here is A. Anxiety related to the anticipation of recurrent severe pain is the answer. So we need to take the interventions. We need to help the patient to overcome, helping their anxiety related to the anticipation of recurrent severe pain. The anticipation of the recurrent pain produces anxiety and threatens the client's psychological integrity. Next question, question number 37. The emergency department nurse is performing an assessment on a 7-year-old child with a fractured arm. The child is hesitant to answer questions that the nurse is asking and consistently looking at the parents in a fearful manner. The nurse suspects physical abuse and continues with the assessment procedures. Which assessment findings would most likely assist the nurse with verifying the suspicion? The answer is B. Bald spots on the scalp. So bald spots, always you remember the child, old child, the small child, if they are going for any physical abuse, the patient, the baby, the patient will be having some kind of physically they will be affected. So you need to check any kind of, when you are doing the physical examination, any kind of abnormality has been noted in the physically, you need to identify. So bald spots on the scalp indicate the baby is physically abused. Bald spots on the scalp are most likely associated with physical abuse. The most likely assessment findings of sexual abuse include difficulty when walking or sitting, torn, stained or bloody underclothing, pain, swelling or itching of the genitals and bruises, bleeding or lacerations in the genital or anal area. Poor hygiene also indicate of physical neglect. All right. We'll move on to the next question. Question number 38. The nurse is performing an assessment on a child in emergency department and notes the presence of old and new bruises on the child's back and legs. The nurse suspects physical abuse and would, and the answer is A. Report the case to the legal authorities. If you are suspected any kind of physical abuse during your work in the emergency department, your responsibility to inform to the supervisor, then they will inform to the report to the case to the legal authorities. Primary legal nursing responsibility when a child is suspected is to report the case. All 50 states require healthcare professionals to report all cases of suspected abuse. It is not appropriate for the nurse to file charges against the father or mother. It is also inappropriate to ask the mother to identify the abuser because the abuser may in fact be the mother. Question number 39. An older female client is brought to the emergency department by a family member with who she lives. The nurse notes that the client has poor hygiene, contractures and pressure ulcers on the sacrum, scapula and heels. The client is suspected of which form of victimization? Answer is B. Physical abuse. Victimization in a family can take many forms. When analyzing a specific client situation, it is important to understand which form of abuse is being considered. Physical abuse can take the form of battering, that is hitting, slapping or striking, or it can be more suitable such as neglect. Neglect, that is the failure to meet basic needs. These all comes under physical abuse. Emotional and psychological abuse can inflicting the verbal statements that cause mental anguish or alienation of the victim. Sexual abuse can involve unwanted sexual remarks, sexual advances and physical sexual act. Alright. Next move on to the question number 40. Client with a closed fracture of the radius has plaster cast applied in the emergency department. The nurse provides home care instructions and tells the client to seek medical attention if which of the following occurs. Answer is A. Numbness and tingling are felt in the fingers. Here, the closed fracture of the radius as plaster of Paris, plaster of cast. Always you remember once the POP is there, POP is applied, compartment syndrome is the common complications. Compartment syndrome means the 5 P's are evident. What are the 5 P's you should remember? Pulselessness. First P is pulselessness, pannor, petechiae, mm, paresthesia. These are the 5 P's you need to remember. A limb encased in a case is at risk for nerve damage and diminished circulation from the increased pressure caused by edema. So, uh, compartment syndrome, if you identified, that area will be damaged by nerve damages can be seen, diminished circulation can be noticed, and because of the increased pressure caused by the edema. So you need to check the signs of increased pressure from the cast include numbness, that is paresthesia, then tingling sensation, increased pain, that's pain, pallor, petechiae. A cast can take up to 48 hours to dry and generous heat while drying. It is normal for the fingers of affected hands are able to move and having sensations. Alright. We have seen 40 questions from previous video and this video from the emergency nursing. I hope you have understand the disease conditions concept, questions, answers, rational. You understood? If you like my video, please press likes and subscribe button. Thank you so much. Thank you.